I'm Dana Parsons with Leading Age Virginia, and I'm pleased to provide you with a brief overview of the recent 2023 General Assembly session. But first, I'd like to thank our Leading Age Virginia Public Policy Committee and advocacy champions for all of their support throughout the session. The committee works closely with the Leading Age Virginia Government Affairs team to identify key legislation and guides the association's advocacy efforts. The advocacy champions advocate by sharing their stories and letting our elected officials know that they have a role in helping older adults throughout Virginia. We are so pleased that 7 more have joined our advocacy champions team during the session, increasing our presence throughout the state. If your community is not joined, please let us know. We can share information about how you can participate. We had the largest government affairs team presence, boots on the ground at the General Assembly than we've ever had before to ensure positive aging for all Virginians. This included our lobbying team at Spotsylvania, Becky Bowers-Lanier, who's new to our team to help support us with hospice and palliative care, and Tracy Lewis, who is a graduate student at VCU, earning her master's degree in gerontology and completing her practicum with us. We were so excited to have her support our team at the General Assembly to learn all about advocacy. The Virginia General Assembly adjourned on Saturday, February 25th, with 1,687 bills that passed out of 2,863 that were introduced. After both the Speaker of the House and the Lieutenant Governor assign the approved bills, they'll be headed to the Governor to sign, amend, or veto. This was a short session with just 45 days versus a 60-day long session. What does this mean? It means we worked on the same amount of bills for a shorter period of time. Next year, we'll be moving into the 60-day session. But this year, the House and Senate will reconvene on April 12th to review the governor's action on all legislation that passed. Unfortunately, our General Assembly did not finalize a budget. What they did instead approve is a skinny budget, which addresses the state's most critical funding needs. Unfortunately, the General Assembly will need to meet again to approve a final budget that includes our amendments that we're supporting to increase the adult day and auxiliary grant rates. I want to thank all of you all that reached out to your legislators asking them to support an increase in the rates to these important programs. Leading Age Virginia is continuing to advocate for these rate increases, and then we'll keep you informed in how you can continue this fight. There were many bills that were introduced during the session impacting aging services. I'll not go through all of them today, but instead focus on 2 that I believe will be of greatest interest to you. The first is the minimum staffing standards for CMS certified nursing homes. This legislation was approved and has been sent to the governor, which he will approve. This legislation provides that 3.08 hours of case mix adjusted total nurse staffing hours per resident day on average, as determined annually by the Department of Medical Assistance for use in the value-based purchasing program, will be required for reporting. It has a delayed effective date of July 1st of 2025. Interestingly, this legislation is only going to apply to a subgroup of nursing homes that includes Medicaid participating nursing homes. This means if your nursing home is private pay or certified for Medicare only, then this reporting requirement does not apply to your nursing home. Also, regulations will have to be developed to implement these new requirements. Leading Age Virginia members will have an opportunity to be involved in this process, so we'll keep you posted. Again, there's a delayed effective date of July 1st of 2025, and then regulations will have to be developed, so it will take some time to get this to move forward. The other legislation was dealing with the regulation of temporary staffing agencies for assisted living communities. We heard from many of you all during the pandemic how so many of you did not want to use staffing agencies but needed to due to workforce challenges. But you let us know about your concerns. They were related to price gouging, to staff showing up without meeting the regulatory requirements, and sometimes staff not showing up at all. So we looked at this legislation as an opportunity to take a comprehensive look at all levels of care related to regulating temporary staffing agencies. So we had the legislation converted to a bill that would study what needs to happen in Virginia for the regulation of temporary staffing agencies for adult day, assisted living, nursing home, and hospice. Unfortunately, the legislation did not pass, but we're looking at an opportunity to have a letter sent from the chairman of specific committees from the General Assembly to ask the Secretary of Labor, in collaboration with the Department of Health Professions, to move forward with this study, because we believe it is a very important issue that impacts our membership. As the session wraps up, we're getting prepared for the 2024 General Assembly session. So please be on the lookout for our call for participation that provides opportunities for you to become involved in advocacy, either as by serving as an advocacy champion, serving on our public policy committee, or joining a council or task force that addresses a topic of interest. If you have any questions or would like to know about a specific bill from the 2020 General Assembly session, please don't hesitate to reach out. We have a very comprehensive report of all the legislation that was introduced and would be happy to share it with you. Again, thank you for this opportunity to provide you with an overview.